The ethos of Together actively supports the need to better understand and value mental health and learning disability issues. And in doing so, we must listen to the voices of people with lived experience, their carers, families and staff. Together gives everyone the opportunity to become involved in a wide range of ways, including engagement, consultation, co-production, peer support and many more. It builds on our existing practice and it gives us the freedom to innovate and extend what we do. Together brings all of the various dimensions of involvement into one framework.
Together is not just a programme, it's a philosophy, it's a way of bringing those people who've really lived DPT services and who've used DPT services into the development of those services.
It makes sense that if you're redesigning a service, to get the people that use the service to be actively involved in everything. And I think it's trying to get a common understanding between the carers, people that use services and members of staff as well.
I was asked to get involved in the Together programme to ensure that we had representation from learning disability services and to think about how that programme actually works for our service user group and their families and carers.
Together's a really good opportunity for me to feed in issues that young adult carers are having into mental health services. So it's a great opportunity to also learn about things that are happening in the services and to feed them back to the carers as well.
I do a lot of work with carers at the minute, and we have created a carers and family strategy. They came from such sort of diverse ranges of being carers that it was actually trying to find some common ground.
We're not only listening to the views of people who've used our services, but we're now beginning to recruit and really treat those people as a really key part of the multidisciplinary team.
During 2018 and 19, Devon Partnership Trust saw the implementation of the Peer Support Work programme. This outstanding piece of work was recognised in the Staff Achievement Awards last year, and the programme continues to go from strength to strength.
It's broken down barriers.
The challenges have just been making sure that people feel their voices are heard, and I think one thing we could probably improve on is just that feedback loop. So once people have shared their views and their suggestions with us, that we make sure we let them know what's actually happened with that input.
We've had big challenges in setting up the new peer support services. Well, I think the NHS has recognised that because of the nature of mental health, they can learn a lot from sufferers, and clearly as sufferers we can learn a lot from professionals.
I think it's fair to say that some of the challenges are that whilst we are a mental health and learning disability trust, a lot of the work that had gone on with the Together programme really was still geared up to making it easier for families and carers and people with lived experience of mental health issues to join the programme. We are constantly thinking about how do we adapt the approaches so that we are really including people with learning disabilities.
I have seen some positive changes and we've had some really excellent support from staff at the DPT.
It's a really exciting opportunity in Together to involve people at all different stages of their recovery. I think it's really great that it's linked in with volunteering as well as paid involvement, and also now linked in with recruiting and involving staff with lived experience.
Together continues to evolve across the organisation, and in doing so, we continue to seek alternative ways in which we can better engage and hear the voices of people, in particular those that use our services, carers and our staff.
I think it's really exciting.